Torsion testis is an entity whose awareness should be known to everybody. More so to parents who've got male children, because this is a surgical emergency which strikes at odd times and odd ages when you would never imagine so. Children from the age of 1 year to 20 years, a male child who has got 2 testes in the scrotum and looks completely normal to you as he grows, plays, and gets bigger and matures himself, could sadly undergo a calamity of an emergency, which we never discuss in public domain. Something which prompts me to look into this subject more frequently when I go through the entity of this emergency. Reminds me every time that we have not done justice of not coming to public domain to explain what does torsion testis mean and how it can strike. So every parent, every father and mother who have got a male child need to know this. We wish and pray that nobody gets this emergency, but this is a natural process of morphology where something has gone amiss. While the male child got the gift of 2 testes which came down into the scrotum from the abdomen where it has actually formed in the entire life and gradually comes and matures itself and settles down into the new house called the scrotum, which is below the groin in males, it could undergo a change. The change is about growth. The change is about being capable enough to bring about the male hormones and then give the confidence of being a male. There's a possibility of an emergency which can happen if these testes are not fixed to the bottom of the scrotum, because they are like bells in a clapper and they could undergo a twist. They are actually supported by a vertical axis or vertical structures called the spermatic cords, which actually make it hang gradually and lower it down at the final trimester and at the time of the birth, when the testis comes and fixed down to the bottom of the scrotum by vernacular. This important aspect of fixity can be missing in some individuals, and we never know who. What happens to them is there could be a sudden twist or a sudden onset twist as a result of a muscle contraction called the cremaster, which houses it. This sudden onset twist of an unfixed or a partly fixed or retractile testis is something which could lead to a calamity. Let's discuss that. So a testis is a structure which is hanging by the spermatic cord. The blood supply goes through the spermatic cord, and this is what supplies the testis. So artery supplies the blood and the veins take away the blood. And this is a natural process going every minute, every hour, and every year of life as a child matures. So from the age group, it could be as small a child to anything at the mature years of adolescence, from toddlers to even adulthood. A testis that is not fixed to the bottom of the scrotum can undergo a twist. That twist, which we call as a torsion, is a sudden onset emergency which could happen at midnight, in the bed while deep asleep. It could happen at play. It could happen while seated in the bus going to school. It could be in a hostel where the child lives, or it could be while a fast delivery is being delivered by him in a cricket pitch. So it doesn't come at any specific kind of an exacerbation, though it's known that straining at stools, straining the muscles, straining the groin could be a possibility that the testis could undergo a twist as a cremaster muscle contracts suddenly. This sudden onset twist can bring about a change in the blood supply of the testis, and that's where the emergency is. The emergency is that the blood supply beyond a point in twist could bring about a complete blockage of the blood supply. And as the arterial blood supply goes down and down, over every passing minute to a golden hour and thereafter, the testis could undergo ischemia. That means loss of blood supply to an end organ where there's only one route through which blood comes in. It cannot go back. So testis starts swelling. The excruciating pain which happened of a sudden onset for this male child could actually become worse with passing time. He could have nausea, he could have vomiting. The pain may radiate up to the groin and confuse the whole picture. If it did start gently and mildly compared to a sudden onset massive start, there could be a possibility of a very gentle discomfort, a discomfort which gradually progresses over time. Or there could be sudden onset pain which worsens, maybe stabilizes over a few hours. Those few hours were golden hours. And we sadly missed it out because with every passing hour, as the testis continues to undergo a twist, the twist may then get fixed. It doesn't get untwisted all the time on its own. As a result of which, that fixity, the edema, the circulation loss, the massive blood supply which has come in and cannot go back, that venous edema, all those only compound and make a vicious cycle of a disturbance, which will finally lead to the absence of complete blood supply to the testis. Torsion testis is an entity that needs to be in a public domain almost for sure. The reason is you have been gifted with precious two, and what could undergo a loss by no fault of yours, it could be so sudden. What happens thereafter is parents would go and see a physician, parents would possibly postpone or would do a self-therapy off the counter. Many of these happen around. It happens across the world. And when that happens, the golden hour is passing by. Attempting to relieve the pain, attempting to possibly treat an infection, which is not an infection, is a wrong thing. In other words, many of these children are labeled as epididymitis, epididymoorchitis, or funiculitis. That's a general labeling which happens with this entity, whereas the entity completely different. It's an emergency of a different kind. So let me explain to you that epididymitis, epididymoorchitis, funiculitis are inflammatory features to the testis and to the epididymis, which are twin structures deep in the scrotum on both sides. And this could be more commonly related to an infection which could be through the blood route, an infection which could be more through a urinary route, more so in people who have got a urinary infection, more so who could be sexually contaminated, or more so who could have instrumentations. But why on earth a small child in his growing years having a sudden onset pain in testis be treated as an epididymis or epididymoorchitis? While we treat him as epididymitis and epididymoorchitis, we actually could be missing out an entity where there could be a permanent loss. And therefore, it's a wake-up call. It's a wake-up call for all our clinician friends who may have dealt or may have heard of this entity, or for all people in the society, especially parents who've got male children. The blood supply getting lost is because of a sudden onset twist in the testis. The testis can undergo a twist and may not undergo an untwisting because it's too late. If you land up in emergency department and the team there looks at it in time, they could actually attempt to untwist the whole thing, make this emergency a semi-emergency, because they would then immediately explore the scrotum and fix the testis the way it needs to be fixed by a surgical exercise called orchidopexy. So orchidopexy, or fixing the testis surgically, is what is the intention of each urologist. Over the last 2 decades in urology, that I have been able to salvage less and able to lose more is only because of the loss of time or the golden hours by colleagues in the society who may not have known this entity. So this entity called torsion testis arrives quite late to us, sadly, because by the time they have been treated as epididymoorchitis, by the time they have been treated as infection, there is a gradual progressive change. That the pain gets relieved, the pain gets lesser. It could be at odd times on a Saturday evening and you think Sunday is a holiday, or you could be at a vacation resort, or the child could possibly be in a hostel. It actually feels scary, but that's how it is when morphological structures don't undergo a complete evolution. So this evolution of coming from the abdomen, where the testis is actually born during the intrauterine life, gradually descending by the morphological route, and then coming through the inguinal canal into the structure that was decided by God to be having a temperature less than the abdomen, 1.5 to 2 degrees centigrade, for it to mature and grow, comes down there and does not fix. If it doesn't fix and is not fixed well, then the entity is on both sides. That means it's bilateral. If you're going to fix one testis, you're going to fix other testis too. So this surgical emergency needs a cure, just not a treatment. That means if a child lives in a hostel and continues to complain that in the last vacation period till now, when I've come back home, I've had 3-4 episodes of pain in the testis on one side or both sides, and this pain comes and goes, then I think we need to wake up to a phenomenon that this could possibly be a mild torsion testis happening to him again and again. He deserves a fixity of his testis, number one. Number two, sudden onset pain in testis in a male child, anytime, needs to be seen by a urologist ASAP. There's no way we could postpone to tomorrow morning. When you arrive in the emergency department, and if it's not too late, and if it's evaluated and examined, we may route you through the ultrasound department to look at the Doppler and the blood supplies of it, because if it's very early, we could actually untwist it live along a Doppler and see that the blood supply suddenly returns. It's about untwisting and the blood supply returns. It's twisted so much that possibly the blood supply is got blocked for a while. This golden hour is an important time, and this can happen in unearthly hours. So waking up to this important awareness drive is an attempt looking at that we have not been able to salvage many as urologists across the country and the world, because the entity is missing in public domain. Parents may not be knowing that testis can undergo a twist, and this twist can be sudden onset, and this twist sadly will be treated as an infection, and those golden hours may pass. Why golden hours? There are people who have come in 2 and 5 days later. The testis, when explored in the emergency operation theater, we find the testis is turned black. The whole blood supply is gone. It is a situation that we need to be aware of. Torsion testis cannot be prevented. It can only be prevented if you're picked on one side, the opposite side can be fixed. But overall, because you never knew about an entity, how would you prevent it? So all male children who got a sudden onset pain in testis saw their urologist in time, probably underwent untwisting in the emergency department while they arrived, converting their emergency to a semi-emergency, and they are explored as early as possible. This exploration brings about opening the scrotum, identifying the testis on both sides and fixing it so that it cannot undergo any more twisting. This twisting is because of a long rope or the spermatic cord and the testis is hanging. More so in mature years at adolescents and adults, it can happen because the testis is unfixed and is still hanging while it's growing because of the age, because of maturity, because of hormones, and the cremasteric reflex is getting stronger and stronger. So any male child who has undergone a sudden onset pain in testis or could undergo a sudden onset pain in testis will require a kind of a care by parents and by caregivers, by physicians and urologists to be taken to the operating room in time, because this is one such entity where exploration is still going to be always the way forward to treat somebody and to finally bring him a cure of an entity. The faster we do it, the better we are. It is all about a clinical acumen that we pick it up. We don't waste a lot of time between the ultrasound and going to the operating room. That means, as I rightly said, we route the patient through the emergency department, through the ultrasound department into the operating room and move it as fast as possible. The ideal therapy for such an emergency would be bilateral orchidopexy, bilateral fixation of the testis so that they don't twist and untwist anymore. But there's a possibility that one of the testis may be unsalvageable because of the delays, and the untwisting on the table may not be possible. Even after untwisting, attempting all the maneuvers on the table, which a urologist continues to do, untwisting may not help. This testis may be gone forever. In such situation, the testis may have to be removed, called orchidectomy. That surgical orchidectomy sometimes can bring about a huge amount of psychological loss and emotional loss to children. If you were gifted with two for no fault of yours, one is taken away just because of an emergency of which you were not aware of. The possibility of preventing this on the opposite side is important, and therefore we do a contralateral orchidopexy in such a state. Imagine if somebody has only one testis in the scrotum and the other testis is not visible there. That's another kind of an emergency we're waiting for. All male children should have two palpable testes in the scrotum. In other words, if the testis is not palpable in the scrotum, it does not mean it's not there. It's very much there. It is lying somewhere in the root of its descent. And the root of descent is anywhere in the inguinal region or inside the abdomen where it was born and decided to stay there amidst this high temperature zones. So one needs to pick it up. So for all parents, if a male child does not have two testes in the scrotum, it's time to wake up. Wake up at the age of 1 year, lesser than 1 year, and beyond at any point in time. Though I see adults coming who have actually got two children and who have also become fathers and grandfathers, having only one testis in the scrotum, the other testis is probably missed out. It may have undergone a loss, it may have undergone a blood supply loss and may have got disappeared and got decimated. But we cannot leave the other entity inside without knowing much about it because it undergoes its own changes around. So testis as a structure which is housed in the scrotum, many a times wrongly thought about and talked about as prostate, which is not a prostate. Prostate is a deep internal structure. Could have an emergency of the kind where a male child can undergo this kind of a sudden onset twist in the testis, only because it's not fixed. Not that everybody has this issue. Most of the time, the gubernaculum fixated is so strong that for your whole lifetime, the testis continues to stay fixed. But for those in whom an anatomical entity predisposes to this important aspect of converting testis that is hanging in balance to a possible emergency, one needs to be aware of. Testicular torsion is an emergency and will always be. For mankind, where there are two testes hanging down in the scrotum, they may not be fixed. You and I will never know that. We'll only know with the mildest of emergency, which should be picked up by a urologist in time. Bring about an orchidopexy bilateral for a hostile child who complained about it intermittently, or for a male child who is still a young male single child and probably complains of this kind of an issue without any aspects of urinary infection. So one needs to wake up that my child has no urinary infection. He's a male child and he gets this kind of a sudden onset pain in testis. He won't wait. We will take an emergency appointment. We will move into the emergency room. We will attempt to get it untwisted, failing which can happen because the twisting to untwist from outside may sometimes be difficult because there's a lot of edema and a lot of swelling setting in. A surgical untwisting on the operating table as an emergency is an important aspect that we need not forget. All urologists are aware for it, and they probably would look at this emergency, not that it should happen, but if it happens, can be brought about to a cure. This was an important awareness drive, which I always wanted to make whenever I saw these entities and unearthly hours being treated for hours or days before they came in. We could salvage less and could probably lose more, but that era is getting over. With a kind of public awareness on umpteen aspects, the aspects of emergency also needs to be known to everybody. Thank you so much.